In today's drug a day series, I'll be starting about Etomidate. What is the chemical name of Etomidate? That is Etomidate hydrochlorate. Etomidate hydrochlorate. So what is the physical structure? I'll be putting the physical structure here. So it is basically an carboxylated imidazole ring. So then what is the availability? It usually comes in a ampule containing 10 ml of 2:1 Etomidate hydrochlorate. So what is the pharmacokinetics of Etomidate? So you are taking the ampule of Etomidate and loading it in a 10 ml syringe which contains 2:1 of Etomidate hydrochlorate. Now you are giving it in the arm through the IV cannula. Mind, it will be very painful. Then it reaches the brain after one brain arm circulation. That is, onset of action of Etomidate is 15 to 20 seconds only. 15 to 20 seconds, that is the time taken for the drug to reach from the arm to the brain. So when it acts on the receptors, it produces its action for a prolonged time for 3 to 5 minutes. So the duration of action of Etomidate is 3 to 5 minutes, and then it gets metabolized in the liver by ester hydrolysis, and then it gets excreted through the kidneys, that is 75%, and through the bile the remainder. So the elimination half-life is around 2 to 5 hours. So what is the pharmacodynamics of this Etomidate drug? It is an imidazole derivative, usually comes at a pH of 7, and it has propylene glycol as a solvent. So when given in via IV, it goes and activates the chloride channels of the GABA receptors. Thus, it inhibits the synaptic transmission. So, what is the effect on CNS? When you are giving Etomidate via IV, after its onset of action, the patient will get induced. How can you find that the patient got induced? The patient will have loss of IRAS reflexes. Sometimes the patient might also have some involuntary movements. Then the patient will be having dose-dependent depression of the CNS. Then the patient got induced. So what is its action on CVS? It is a cardiostable drug. Thus, it is used as a drug of choice in cardiac patients. Then what is the action in RS? It has very minimal effect in respiratory system. Then what is the effect in GAT? It is very important that Etomidate causes post-operative nausea and vomiting because it is an emetic. Etomidate E, emesis E, E for E. So what are the side effects or adverse effects of the drug Etomidate? So for this I have formed a mnemonic from the word Etomidate itself. E is emesis. We have already seen that it causes postoperative nausea and vomiting. And T is thrombophlebitis. When given on IV, it causes pain or irritation on the veins. 3 is O, that is osmolar. Because it is highly osmolar, around 420 to 430 milliosmoles per liter, it is causing this pain and thrombophlebitis. 4th is M, that is myoclonus. It causes sudden involuntary muscle movements. 5th is I. It goes and inhibits 11 beta hydroxylase. Because of that, it reduces the cortisol production. So I is inhibition of 11 beta hydroxylase and D is decreased cortisol. Then we have A, that on rapid injection it produces apnea to the respiratory system. Next we have T, that is tremors. Sometimes it causes postoperative shivering, although rare, it might be seen. And E is obviously Etomidate. Although being a cardiostable drug, we are not using it often because of its cost, that it is expensive. So E, emesis, T, thrombophlebitis, O, osmolar, M, myoclonus, I, inhibition of 11 beta hydroxylase. Because of it, it causes D, decreased cortisol production, A, apnea, T, tremors or shivering, E, expensive. So what is the special concern about this drug Etomidate? So we have already seen in the side effect that because of the inhibition of 11 beta hydroxylate, it causes steroid suppression. That is, there is reduced amount of the production of the hormones cortisol and aldosterone. So because of it, this reason we are not using this drug as an infusion, like we are using propofol as an infusion. We are not using this drug because of this inhibition of steroidogenesis. And they have found in the studies that single shot of etomidate does not produce any inhibition of steroidogenesis. Even if it reduces, it is very temporary effect only, which is lasting for less than 6 hours. So regularly we are not giving any steroid administration for any elective patients posted for surgery, but in rare circumstances who are steroid depleted, for example septic shock patients, we might have to start steroid supplementation and taper it slowly for up to 72 hours post etomidate administration.